because of Dr. Alan Chen, the man who's coming up here now. I believe 40 million tests are performed around the world last, was it 40 million?
4 million.
4 million, sorry.
Last year.
Yeah, I confuse the numbers because, I speak Chinese as first language, the zeros. Chinese will get that, everyone else is like, what? 4 million tests around the world, non-invasive, and as a parent, I can't tell you how big a deal that is. The type of non-invasive testing, he's brought it to cancer. He's a Hong Kong, the real deal. The company was Cirina. They have merged with GRAIL out of the United States in a big deal that everybody in this town is very proud of. So please, big round of applause, big welcome for Dr. Alan Chen. Alan, thank you.
So, thank you for inviting me to share my thoughts here. So before I start, I want to ask you one question. What is the best treatment for cancer? So the best treatment for cancer is actually early detection, because despite a lot of advancement in medical treatment over the last 2 decades, there is very little options for treating metastatic cancers, even for now. So, but how can we detect cancer early? So we provide one solution for you. So I think one possible way is to detect the cancer-derived DNA from the circulating DNA circulating in the blood plasma. And this method is called liquid biopsy. And liquid biopsy has become very hot over the last few years. And it has named it to be one of the 10 breakthrough technologies in 2015 by the MIT Tech Review. And this journal also identified some key players for the development of liquid biopsy technologies, including our group in the Chinese University of Hong Kong, Illumina. Illumina is the largest DNA sequencer platform manufacturer in the world, and Bert Vogelstein's group in Johns Hopkins. So, with the support of the government and the university, 3 professors from our group started a company called Cirina, and it is based in the Hong Kong Science Park. And almost the same time, Illumina established another startup company called GRAIL. And the mission of these 2 companies are very similar, and we want to develop tests that can detect cancer at the stage that we can cure the cancer. And because of the similarity of our goal, and we think that if we work together, we can achieve a better chance of combating this deadly disease. So we had a merger last year. And the ultimate goal of the company is to develop a generic test that can detect all types of cancer at the stage when it is still asymptomatic. But can we do that? So our group has worked on this technology, DNA-based technologies, for more than 20 years. And in 1997, Professor Dennis Low from our group discovered that when a woman is pregnant, the baby's DNA would be circulating in the blood plasma of this pregnant woman, so that it opens the possibility of detecting the baby's DNA in a very non-invasive way. And through the 20 years research, we developed numerous methods for detecting different genetic abnormalities of the baby. And because of these developments, Dennis received the inaugural Future Science Prize in 2016, which is also recognized as the Chinese version of Nobel Prize. And because the biology of a growing cancer is very similar to the biology of a growing fetus in the pregnant woman, so most of these technologies can be shared for the detection of cancers. And one very important application is for the development, is to detect Down syndrome. And Down syndrome is caused by the presence of an extra copy of chromosome 21 in the baby. So normally we have 22 pairs of chromosomes, but if the baby has one extra chromosome, so that there are 3 copies of chromosome 21, then it would be affected by Down syndrome. So we developed a very elegant method to estimate or determine the precise chromosome dosage of chromosome 21 by just analyzing the maternal plasma DNA. And this method was proven to be ultra accurate with an overall accuracy of 99.7%. And because of its robustness, it has been rapidly and extensively used throughout the whole world. And in 2017, there are 4 million tests performed using our technology in over 90 countries. And it leads to a reduction in the percentage of invasive procedures by over 40%. And this drop in this tendency is still going on. And we used similar technology for the detection of the chromosome copy number changes to detect cancer. So let me use the liver cancer as an example to illustrate the power of this approach. So this is the result of a liver cancer patient. The chromosomes are arranged from chromosome 1 to chromosome 22 in a clockwise manner. So first, we look at what we observed in the tumor by sequencing the tumor tissues. We can observe that there are some dots. The gray dots means that there is no abnormality. And the green dots means that there is duplication of that chromosomal region. And the red dots means that there is a deletion of that chromosomal region. Then, what we observed, then we collect a blood sample from the patient before the treatment. And we observed a very similar pattern of copy number alterations in the plasma compared with the tumor. So that it means that we can get the information of the tumor by just looking at the plasma. And after the resection of the tumor, we collected and all the blood samples and all the abnormalities are gone. It indicates that the same technology can be used to monitor the treatment outcome of these patients. And this method can be generalized to detect all types of cancers because copy number aberrations is virtually present in all types of cancer. But if I have a blood test that can detect all types of cancer, is it useful clinically? The answer is not really. The reason is if a patient comes to my clinic and then I performed a blood test and then I found some abnormalities, the most important information is where is the abnormality come from? Which organ I should look for? So should I do a MRI brain, CT thorax, or CT abdomen? So we need to identify the source of tumor-associated abnormalities. But this task is very challenging because all the DNA in our body shares the same sequence. So I cannot differentiate a DNA based on its sequence, whether it is coming from the brain or the lung or the liver. So it is a very challenging task. So how can we do? Because different organs need to carry out different functions so that different sets of genes are switched on. But if we compare this, the mechanisms leading to the switch on and switch off of the genes is called methylation. So different organs would have its own patterns of methylation. And based on the methylation analysis, I can know whether this piece of DNA comes from the lung or the abdomen or the liver or the colon. So yes, we can have this test. So this is a test called delta M analysis, which is used to identify the source of abnormalities. For example, if we test the liver cancers, then the liver lights up. If we test the lung cancer, then the lungs lights up. And if we test the plasma of a colon cancer patient, then the colon lights up. So that in the future, when a patient comes to the clinic, the first question I ask is whether there is a cancer in the patient, and if yes, then where is the cancer? So if we have a test that can detect cancer, then the next question is whether a small tumor would release sufficiently large amount of DNA into plasma to allow early detection. So to answer this question, we use nasopharyngeal carcinoma as a model because this cancer is very prevalent in the southern part of China. So over the last 4 years, every weekend I went out to the community to recruit subjects for this study, and we recruited over 20,000 subjects for this study. So as a result, my golf handicaps increased by 20 strokes. And what we found is using liquid biopsy, for those individuals who are tested positive using liquid biopsy, we would further investigate them using nasal endoscopy as well as MRI. And then we identify, using this arrangement, we identify 34 cases of nasopharyngeal carcinoma. And if we compare the stage distributions of these patients with the individuals without undergoing screening. So if we look at all the nasopharyngeal cancer patients in 2013, according to the Hong Kong Cancer Registry, we can see that only 20% of them had stage 1 or stage 2 disease, and 80% had stage 3 and stage 4 disease. But if you look at the patients that we identified through screening, half of them had stage 1 disease, and stage 1 and stage 2 patients account for over 70% of our patients. As a result of these change in stage distributions, we result in a much better progression-free survival. These two graphs, the red lines represent the survivals of patients identified by screening, and the blue curve represents the survival of patients in historical cohort without screening. The hazard ratio for these two curves is 0.1, meaning that there is 90% reduction in the probability of disease recurrence or mortality based on this screening method. So, and because of this finding, our study has been chosen by the New England Journal of Medicine, the most prestigious journal in clinical medicine, as one of the top 10 notable articles in 2017 in terms of advancing medical care in the world. So, apart, having developed all these technologies, we are also very conscious about protecting our intellectual properties by filing a lot of patents. So, to illustrate our approach to protect our intellectual properties, let's look at the cancer genome. In the cancer genome, there are only a few number of changes present in the whole genome, including point mutations, copy number aberrations, methylation alterations, and fragmentation pattern changes. So we have found a large number of patents to cover the methods to detect all these changes. And the foundation patents were filed well before all the other people were aware that this is a valuable area to explore. And then, because the technologies are shared between prenatal testing and cancer detection, and prenatal testing has been a very well success in the market, so we received a lot of challenges to our patents, and we have proven in a lot of lawsuits that our patents is proven of its validity and enforceability. So as conclusions, we developed the leading technologies for plasma DNA analysis, and we provide the only large-scale prospective study to date to demonstrate the improvement in survival by screening cancer through liquid biopsy. And we have a strong patent portfolio. Thank you.
Thank you so much, Dr. Chen. Dr. Chen, you did run over time and into your question time, so we're going to have to let you go, but you are a Hong Kong hero, so we gave you that extra leeway. So thank you very much for coming and presenting. He's done amazing things and is doing more amazing things in the area of cancer detection. Thank you so much, Dr. Chen. Thank you. Okay, thank you.